If you have chronic knee pain, you have likely been told a simple story. Your joint is like a worn tire. The tread is gone. Bone rubs on bone. And the only rational option is to cut it out and bolt a metal and plastic replacement. It sounds logical. It is not. ஆனா அது உண்மை இல்லை. It is a mechanical illusion that treats a living adaptive body as inert machinery. In philosophy, this is called dropping the context. In orthopedics, dropping the context is the single biggest reason joint treatments fail.
Doctor, about that pain.
When a surgeon replaces a knee without first asking why it degenerated, they are not solving the problem. They are overshooting it. A deteriorating joint is not a mechanical accident. It is living tissue responding to an environment you can actually measure. And that environment is not a metaphor. It is 4 specific numbers, the terrain your joint is trying to survive in. I gave those 4 numbers their own video. I will not rerun them here. Bolt a perfectly engineered implant into an inflamed, metabolically hostile body, and you have not cured the disease. You have masked it while the fire keeps burning. உள்ளுக்குள்ள நெருப்பு இன்னும் எரியுது. At the Madras Joint Rejuvenation Centre, we built a protocol around the opposite principle. We refuse to treat your knee in a vacuum. உங்க முழங்காலை மட்டும் நாங்க பார்க்கறதில்ல. We call it PRASAD. It rests on 4 disciplines. First, we read the terrain. Then, we prepare the soil. I showed you exactly how, step by step, on April 12th. I will not repeat it here. Then, we treat the root. A 3-layer biological treatment into the joint, into the synovium, and into the subchondral bone where the actual pain lives.
The fluid directly targets 3 distinct zones. First, it fills and lubricates the joint space before penetrating deep into the subchondral bone.
These layers work through paracrine signaling. Biological messengers calling your own resident cells to action, not by replacing your tissue. PRASAD does not regenerate cartilage. Nothing does today. What it does is preserve what you still have by treating where the destruction is being driven from. And finally, we sustain the system. The terrain that produced the disease will produce it again if it is not maintained. Your knee is not a car part. It is living, it is adaptive, and it is inseparable from the body it belongs to. You do not have to accept a treatment that drops the context of who you are. There is a rational alternative. It holds the full picture. It is called PRASAD. பிரசாதும் அப்படிதான், ஒரு வரப்பிரசாதம். Stop treating the symptom. Rejuvenate the system.